Can you please take the roll?
Carberry Montgomery,
Here.
Kroll,
Here.
McBurney,
Here.
Obrecht.
Here.
Thank you.
Do I have a motion to approve the agenda?
So moved.
Seconded.
Moved by Kroll, seconded by McBurney.
Kroll,
Aye. Yes.
McBurney.
Yep.
Obrecht,
Yes.
Carberry Montgomery.
Yes. On our agenda tonight is public input for the American Rescue Plan Act projects. I'm going to turn it over to AJ to give us a little bit of guidance before we start with public comment.
Madam Mayor, thank you, members of council. Thank you. This will be our second session in which we're soliciting public comment and input concerning the expenditure of the American Rescue Plan dollars that have been allocated to the city of Urbandale. Just quickly, after all the proverbial dust has settled and all the regulations and rules have been promulgated by the Department of Treasury, the city will be receiving and has received at least its first payment of a total of $6.6 million. Just again, real recap is that there's an obligation once we've accepted the money that we will allocate or will encumber the money by December 31st of 24, and all the funds will be spent by December 31st of 2026. Any remaining funds will have to be returned to the federal government. And again, there is a short list of things that you can't do with the money, and we've reviewed that a number of times, and those are not really applicable to our discussions, haven't been to our discussions to date. And one of the clarifications we received in the last iteration from the Department of Treasury was that if you have up to $10 million can be claimed as lost revenue for municipal revenue, and there is no documentation needed up to $10 million. For us, at $6.6 million, obviously that's a very, very desirable path for the council to consider and to take, and that's the direction I believe that we've received so far, is that we will claim that as lost revenue, and that gives you a tremendous amount of flexibility about how you're going to use those dollars. So having said that, the council's desire was to receive input from the community concerning the possible uses of those dollars to be utilized in response to the COVID pandemic the last 2 years. So our first public hearing was, we had categories that the council, that staff provided to council during the previous Lunch and Learn to gauge your interest in various of the categories. Overwhelmingly, the category of community contribution was your highest priority. And at the last council meeting, you had two individuals who spoke as to suggestions about utilization of funds for that. Pardon me. The next category that is tonight's subject of discussion will be social and environmental programs. That was the second rated category that the council came up in their own survey as to importance they believe to those any program that would fit that criteria would be of importance to the community to look at. Unfortunately, we had some, we have programs, pardon, we have, not unfortunately, but we have ideas and suggestions that have already been generated by the staff and by the council. And again, tonight was your opportunity to hear from the public about their suggestions about those dollars. Be happy to answer any questions that you may have. Otherwise, that we may have people here tonight that wish to speak to this matter.
Any questions for AJ? Okay, seeing none, are there any members of the audience that would like to address the council? Why don't you come to the mic, Dr. Johnson, and introduce yourself, and please leave your name and address for the record.
Good evening. I'm Dr. Nalo Johnson.
It's on. It is on.
Little green light. It's on.
It looks on. Maybe I can move it a bit. Is that a little better? Okay. I'm Dr. Nalo Johnson, 14912 Ironwood Circle here in Urbandale. While I am an Urbandale resident, I'm actually here through my professional role as the president and CEO of Mid-Iowa Health Foundation, which is a private nonprofit foundation that has served Central Iowa in addressing community-based needs for over 37 years. So I'm not certain, do we have a certain amount of time available or?
Well, technically, we generally give people 5 minutes, but since the audience is pretty limited, that is not paid by the city of Urbandale, you can take as much time as you need, but we definitely need to stop by 5:50. So hopefully much less time than
I
that.
have 5 minutes prepared, so good to hear, good to hear. Again, our emphasis at Mid-Iowa Health Foundation is addressing the social determinants of health. So thinking about those social, those environmental, and those economic barriers that impact health outcomes for children and families in our community. So over the past few months, we've worked with many community partners, including local funding entities, as well as academic institutions and our nonprofit community-based organizations to champion a basic income pilot project for our community. So we feel that this is an exciting opportunity to be able to support what is a community-wide collaborative learning project that directly addresses the economic well-being of Central Iowa residents, as well as provides us an innovative opportunity to understand and help our public, private, and philanthropic decision makers to help them understand the most impactful areas that they can direct resource investment. So we'll be following a best practice model, and the pilot will be structured as a randomized control trial. We'll have 110 participants who will receive a monthly $500 income payment. And then we'll have 140 participants who will be a part of the control group, meaning they're not receiving that payment, but their experiences will be compared to the experience of those receiving the payment. We'll also note that as we're collecting data, all engagement with participants, whether it's in the control group or those receiving the payment, are paid for their time to conduct interviews or participate in surveys. So everyone is compensated for their time. The monthly payments will occur from a 12 to 24-month period, depending upon how much money we're able to raise to support the pilot project. And we're fortunate to have secured the leading experts in the field of economic inclusion from the University of Pennsylvania to be our lead researchers for this project. But again, wanting to make sure we're keeping this a local collaborative effort, they'll be working in collaboration with Drake University at the Harkin Institute, who will be leading the project coordination effort, and contracting with Des Moines University's Public Health Department for local evaluation support for the effort. They'll also be tracking some very specific participant measures throughout the process, again, wanting to see this impact around health and well-being for our community members. So some examples of the things they'll be tracking include things like anxiety and depression scales, access to preventive health services, worker absenteeism, and social and civic engagement measures, so thinking about things like, do folks have the ability to attend their child's school event or after-school event, or have the ability to afford enrolling their child into some of those extracurricular activities? And then also ability to afford an unexpected emergency cost. So among many other measures, but wanted to highlight some of those for you. The results from the pilot will be shared with our community to help us understand the impacts resulting from low-income community members having access to a sustained amount of assistance each month. And we anticipate that there will be potential for impacts across a number of different areas, but including things like policy decisions as well as resource investment decisions. And in response to the hardships that have been brought on by the pandemic, we're seeing communities across the country utilize ARPA funds to stand up these pilot projects. And we feel that these pilots seek to not only improve the health and well-being of the individuals and the families who are participating by removing that monthly income volatility, but also it supports the economic health of the entire community through improving the ways in which community members can show up in the workforce and not have those burdens that are brought on by the stressors that are associated with experiencing poverty. So total project costs for that 12-month intervention period, which would be a total of a 2-year project period, are $1.37 million. Total project costs for a 24-month intervention period, which would be a 3-year total project period, are $2.46 million. I want to be clear, over 50% of those project costs are going directly towards the monthly income payments for participants. And the more public funding that we're able to receive for the project, the more private funding that we're able to leverage in order to ensure the private donor investment in the project as well. So we have an exciting opportunity to work with leading researchers in the country regarding this effort and be a part of that national conversation that's occurring right now around basic income as a poverty reduction strategy for consideration. So on behalf of Mid-Iowa Health Foundation and our collaborative group of community stakeholders, we wanted to thank you for your consideration of ARPA funds to support this effort as a successful implementation of an innovative and a community collaborative project. I know I sent some information to you all earlier, so I'm hoping that I also can take questions if you have any at this time, but I'm also happy to meet with folks one-on-one as well if other questions come up.
Thank you for the information, Dr. Johnson. Does anyone have any questions? I'm sure at least I know Amy does.
Well, I've had the opportunity to be corresponding over the last 24 hours, but I do think it's important to note how much of the total budget are you anticipating asking Urbandale for?
Yeah, so I was looking at just population, so as a percentage of overall Polk County population, I think Urbandale represents about 10% of that. So I would say 10% of total budget costs would be a respectable amount for contribution. I would also state we are looking at the geographic footprint of our Tri-County Community Health Needs Assessment area, so including Dallas, Polk, and Warren counties, just to give you a sense of where we'll pull program participants from. Also want to be mindful and say, you know, we want to respect the scientific integrity of the study as a randomized control trial, so we can't guarantee any community the percentage of participants, but again, the more we engage community members and make them aware of this opportunity, the higher the probability that you'll have residents from a certain area participating in the pilot project.
Thank you.
Mm-hmm.
With the 250 participants, what non-monetary support is going to get shared for everybody, I guess? I'm assuming that everybody gets some support.
Yeah, so we're very mindful of so I'm a trained public health professional, I should just throw that out there. So very much come from this data-driven, community-based participatory approach. So we're being very mindful of working with our community-based organizations in order to not only champion the project, but kind of be that liaison for or with participants throughout the project as well. So we're thinking about that in terms of helping navigate other services that they may want to engage with, also assuming that they're already having trusted relationships with program participants, but also in communication with the project coordinator and coordination team that will be out of Harkin, so that if there's troubleshooting that needs to occur specific to program participant needs, that's part of that duty of the project coordination team. And the only other thing I could recognize is, again, we're ensuring that all participants in the project are compensated for their time. So if they're filling out a survey, if they're having an interview, if they're speaking to the public about their experience, they will be compensated for the time. I think right now in the budget accounts for about $50 for every type of engagement like that. And that's throughout the project period because there will be multiple surveys.
Have you received any commitment from any communities yet as far as for public dollars from?
So Mid-Iowa Health Foundation has committed an initial $200,000 towards the project. We have other private funders that are lined up. However, they're looking to see what the public investment looks like before committing a certain number to us. I will share, I've been in conversation with staff at both the city of Des Moines as well as Polk County. I have some other communities who are interested as well. So we're just starting to get out there to have these conversations, knowing you're making decisions now around your ARPA dollars. So definitely the more public investment that we have, the more I can secure on the private side.
And what is your timeline, again, to kick this all off?
No, good question. So we anticipate, again, with the decision-making process that is coming from the public sector and then some of the grant-making processes through the private foundations, that we'll have all the money secured by the end of summer, which would allow us to then hire for that project coordination team through the Harkin Institute. So we would anticipate to have the participant selection process starting in November. And have the actual first payment out the door to the participants in February of 2023.
I know in many instances, once you start down a path and you can leverage funding to support a pilot project, oftentimes there are other funds that can leverage down the road. Do you have any sense that that may be the case with this particular opportunity?
To like sustain the program
Not
post?
necessarily to sustain, but, you know, oh, well, we've now piloted, we know, and maybe we're going to try and pilot something that is in addition to it down the road. So oftentimes you'll get demonstration projects that lead to other demonstration projects, et cetera. Do you get the sense that this might be one of those scenarios? I know it's awfully early to tell because you're just standing it up with ARPA funds.
Yeah.
I'm just curious.
I would say at this point in time, the goal is let's make the case for this type of pilot project to occur and then use the learnings from that pilot to then pivot for decision makers as to where you'd like to go next. But I do think there is beauty in this project to see how collaborative it is in terms of the different organizations throughout our community that are engaged. So both from that community-based organization standpoint, as well as our academic institutions, as well as our private funding agencies and hopefully public as well. And the fact that we have private foundations, corporate foundations at the table, that this is something that across sectors, folks are engaged in supporting. And I think that's standing up a really interesting model for whatever could come next.
What do we anticipate is going to separate this research project from other basic income research projects that have been conducted? And I guess, what makes this different?
It's a good question. I think what's really exciting for our community to be considering this is the fact that it's not occurring within the Midwest, right? So you see most of these pilots being stood up on the coast or in larger, more populated and oftentimes more politically progressive areas. So the fact that Central Iowa would be willing to take this on, given our demographics, both geographically, but also politically, I think would be really interesting to add that kind of data to this larger national conversation of what it means for a community and the potential health and well-being outcomes that can occur from standing this up as a poverty reduction strategy. I'll be very frank and say, I think that's how we landed the University of Pennsylvania researchers to work with us, because they recognize that this is a very unique opportunity to engage with. And it really does benefit us to be able to have their expertise on board. So being able to capitalize on this time to be able to utilize their expertise is really critical.
How does this, I think this is kind of a follow-up to what Larry asked, but how does this program that you're talking about differ from what Johnson County is utilizing some of their ARPA funds with just a direct payment? I think that's what it is.
Yeah, from what I understand that Johnson County is doing, they're doing like a one-time cash infusion, which that's an interesting strategy, but I think from a data-driven standpoint, understanding true impact around that would be difficult to understand, in the same way that we're able to talk about what does it mean to have a sustained amount of this additional income over time. So I don't know how they've set up their kind of tracking purposes, so I can't speak to that. I can say that based upon the research I've done, the randomized control trial with a sustained amount of time is a much more scientifically valid way to track impact. So I would recommend our strategy.
Well, that's good to hear. So do we have other questions? for Dr. Johnson. So AJ, do you want us to go into some generalized discussions now?
Thank you.
So thank you. You're welcome to hang around. I think we're going to have some more discussions regarding ARPA in general, which may or may not be interesting.
They're always interesting. Well, what I was, one of the ideas that I had spoken to the mayor about, and trying to keep this on track as far as a process to have decisions made and that you can talk to groups that give them some answers, those who have made some inquiries, and also to keep our timetable on a manageable timetable, because again, as I mentioned, you know, we have the money to spend, we have timetables that are set by the federal government that we have to meet, and we don't want to lose those opportunities depending upon if it's going to be something that you're going to support a program like the doctor explained to us, or if you're going to support a construction-related project, or whatever you decide as a council that you think has the greatest good and impact the community, you don't want to get caught in a situation where you don't have time to implement it. So that's where, in speaking with the mayor and then also with the staff who have been working on this, is that, you know, we want you to keep this process going so that you don't lose those opportunities. So tonight we do have some additional time that you can begin some of those discussions based on what you heard at the last council meeting, based on the information that has been sent your way through contacts that you've had or people that have reached out to you as council members. You also had the cumulative list that was included in your packet or made available to you that gave you the ideas that had been solicited among yourselves and among city staff as ideas that could be used. And again, just beginning that process of dialogue now to start looking at these ideas that have been suggested so far, do they resonate with you? Do they hit those buttons that you think are valuable to the community and that you want to continue to pursue? Some of the ideas so far have been very general, is that they think that you should do something like this without very many specifics. The example tonight was very specific and very detailed. So you have things that go from I have a great idea, but nothing to back it up, so to speak. And then I have a great idea that here's a lot of information that you can use to implement with. So I think your time now is spent before the council meeting is just to begin starting that discussion. And then also I would suggest that given the small but enthusiastic turnout we've had from individuals who have come here tonight and from other nights, is that maybe we shift gears to make a spot on the regular agenda to carve out time after the citizen forum that says now is a time for individuals to come forward if you have ideas or suggestions, and we would advertise the various categories just as a matter of expediting the discussion. And again, at some point in the very near future, you will need to convene as a group and start making some decisions as to where you want to go. Because again, 6.6 sounds like a lot of money, but it can be spent awfully quickly on a singular project or on multiple projects. But again, I think that is, you're nearing those decision points where, you know, you need to start making as collectively as a group a decision about where you want to go. And if it's something that needs, if you focus on a particular project or an issue and it needs some additional staff investigation on your behalf, it gives us time to do that as well. So I would leave it to you folks tonight to maybe discuss among yourselves, because it was designed to be a discussion process in session. And I did not anticipate that you make any decisions tonight, but again, it doesn't hurt to start having that discussion.
So AJ, when will we be getting the summaries from the comprehensive strategy process that we just did a couple of weeks ago? Because I could see that informing the decision.
I'm going to look to John because he's been shepherding that on behalf of staff, so he'll be able to give you a little bit more insight as to, you thought you were going to go with nothing, John, I know.
Sorry, John.
I was in the back hoping to just listen tonight, but that's fine. Council members, we had a follow-up debrief with Housel Levine on Monday. They are putting together the summaries from the stakeholder group, the P&Z council meeting, the visioning, and the downtown discussion and should have those back within a 2-week window. And we'll make sure to share those. The next step in the process is to do the assessment of where we are today. And that is hopefully to be done by the first part or middle part of July. So to answer your question, Councilmember Cole, a couple weeks, I would say by next Friday, we should have those back.
Thank you.
And remind me again, when it comes to the restrictions for ARPA funds, is a program like this even feasible at our level, or?
Yes, the restrictions, and I will again tap into John's memory as well. The restrictions had to deal with.
Sorry, John.
And see, Nikki bailed out on us. So. But the restrictions are you can't use it for pensions. You can't use it to reduce taxes. You can't use it for capital programs for debt. I'm sure there's something else, but those are 3 that stuck with me.
Now,
Debt payments, not
Debt payments.
capital payments, right?
yes.
Debt payments, yes.
And then actually, based on the council lunch and learn discussion on ARPA last time, you had agreed to direct staff to take the full 6.6 as lost revenue. That has been filed with the Department of Treasury as of a couple weeks ago. So that means you can do things that are inside of what you typically budget for on an annual basis.
All right, yeah, I just wanted to make sure that we had done that, and, okay.
So this program as described tonight would fit in that category of eligibility.
I would defer to the further looking at what we currently do today versus how the program is structured. But you are taking lost revenue. So if you don't fund a project out of ARPA funds, you could always backfill something else, a police cruiser, and reallocate those funds to a project like this.
Well,
So-
that's
so yes, that is,
That
we
was a-
can find a way to make that work.
Very well
Like a
put.
recreational van.
Very, very well put, John. Yes.
Heading towards was
You have a
making sure.
significant amount of flexibility under the lost revenue part than you did under the original components of the ARPA program.
Thank you.
I guess for me, the second part of your statement is, should we just put this under the citizens forum piece going forward? And I think having 2 meetings and now 2 actual speakers in 2 meetings, I think, yes, that would be appropriate in my mind. To just include this in the future, just regular agenda items. I don't think it's gonna be that much of a time killer.
Okay.
But as far as narrowing down the list, I think having been to 3 different comprehensive plan meetings, I think there's a theme coming out of that. And I want to see what the consultant, if they're hearing the same theme or not, before we move too far down the line on this. I think waiting 3 or 4 weeks isn't going to delay anything we can do from an ARPA standpoint. But I think that's going to be for me, I think it's going to be very informative of how should we be directing ARPA, knowing that I think there was a theme out of the meetings. We'll see if they come back with the same idea. That's why we're paying them, that's where we're paying them significant dollars, is to tell us.
Yeah, I felt it was very thematic as well.
Right, and so it's just like, we have this opportunity in front of us, we may be able to put the dollars towards it, we may not, but I don't think 4 weeks is gonna limit our ability to use the ARPA funds.
Well, and it falls within our original timeline, which is kind of what we're
So,
thinking with the. kind of-
Unfortunately, from a staff standpoint, that doesn't narrow the list in any time frame currently,
Or it may.
but
AJ, do you think you could put together like a proposed schedule for us with the remaining topics, the council meetings that they would be discussed at, and then possibly a special meeting? I don't know.
Certainly.
Because, I mean, I think we can spin around in circles for a really long time on how to spend this money. But I think we need to have a little, I mean, you started a good structure, but now we're seeing that we can condense it maybe a little bit. And if we could, aim for a late June, July, like, I don't know, special meeting or
Certainly.
special lunch and learn or something along that line where we actually make a decision, or I don't know, because
Well,
I
and-
guess I just don't see where we start making a decision
Well,
from where
and-
we're at right now.
And to be fair, in the light of a data-driven decision-making model, we've had several community conversations in the last 2 weeks that I think we would be remiss not to include in our decision-making process. So, I mean, we spent the time to get significant input from the community. We had significant participation. I just think we need to include that as we are looking at, I mean, yes, it disappears quickly, but it's still a sizable chunk of change.
No question about it. I think, given the update that John has provided for the Housel-Levine study, is that if we incorporate those timeframes into other things that we may have outstanding, that we want to make sure that you at least have input from, developing a schedule for you is not going to be difficult, quite honestly. In all respect to the process, we somewhat anticipated at the staff level that we might be narrowing this down quicker than later, just because you did have the comprehensive plan opportunity. You've had input from other sources when we began this process. You had a significant list developed by yourselves and by staff. So developing ideas that fit within the parameters of the program, at least at the initial phase, we didn't think was a problem. I mean, again, you had a lot of really neat things that you could look at. And so condensing it is not going to be a problem. I will work with staff to look at the timeframes, incorporating what we've just talked about with the comprehensive plan. Anything else that's outstanding that we need to make sure that we work around or work into at this point in time. We've gone through a number of, you did a strategic plan, you've done the CIP, you've done the budget, you've done the comprehensive plan. You've had some really significant activity in the last 4 to 5 months. We kind of go into that. Now we're into some of the operational issues as we close out this fiscal year. We get ready for next fiscal year. As you'll see on items on the agenda, a lot of them had to do with physical projects, buying equipment. So from a staff standpoint, we're making those transitions, but this is not a problem. We'd be happy to put together a calendar for you that fits within the parameters of our discussion tonight.
I guess to narrow it a little bit we got 2 more council meetings in May. Maybe those are the 2 that we have public hearings at for the rest of the project list. And then June 14th is when we start narrowing it. It sounds like we would have maybe some of the comp plan data by June 14th.
Would have definitely the summations, and, community input will continue through the month of June. We've had a nice response so far. We have 168 questionnaires filled out via the website, and there's over 90 data points on maps. So we anticipate that to grow, so we should have some nice information by the middle of the first part of June too.
Right. Because then I'm just thinking of part my own schedule too, but we get to the last meeting of June, now we're getting close to 4th of July, a lot of vacations. I'm just not sure how many of us will be around at some of those meetings. And that first meeting in June, these past couple of years has been a little light on items.
Certainly, we can coordinate with your schedules, your own personal schedules, if you know them as we get into the summertime. Again, as you mentioned, people start planning vacations. You have children activities that you want to be a part of, all sorts of things that happen in our lives during spring and summer. So we want to make sure that we get everybody's input as to when's a good time for people to meet. And again, as we've talked about it previously, having a special meeting, dedicating, a couple 2 to 3 hours on a Saturday. I hate to say that on a Saturday. I know it's sacrilege on a
It's
Saturday.
summertime.
It's summer. I understand, but we'll do it at an outdoor shelter. But we would find time that would fit your schedule, and if it needs to be more condensed, that you have 2 or 3 to 4 hours to really knock it out. Great, if that works for people's schedules. So again, your goal so far has tried to be as transparent and as inclusive as possible. And I think you've done an admirable job in that. But again, there's a lot of different factors that you don't control that will affect this outcome. So having said that, we'll work on a schedule for you.
Oh, did you have something, Eric?
Yeah, I was just gonna say, I think if we could even commit to, whenever we set this special meeting, to have 3 or 4, that we narrow it down to, that way we start to build a consensus at that point, and we can start to see where everybody's ideas are. That would help us speed up the process.
AJ, what are the remaining topics, general topics? We've done community contributions and social environmental, but what were there's 4 more, correct?
Yes, quality of life amenities and enterprise infrastructure were tied for the next one. And then city facilities and services and roadway and mobility improvements.
Okay.
Quality of life, and then what was the fourth, the
Um,
tied one?
The tied ones was quality of life amenities and enterprise infrastructure. And then the other ones were city facility services and roadway and mobility improvements. I will recirculate this to the council.
I think it was Adam suggested that we maybe hit 2 of them,
Do it the next meeting, do it the
Two.
meeting after that.
yeah,
You
combined.
can hit these 2 probably.
Yeah, and then the next 2 at the following meeting.
So you have the 17th and the 31st.
Right, so then by the end of May, we've done a hearing on all 4 of them, or all 6 total. And then that June 14th is where maybe we can start the process of narrowing it down, but we should have some of the comp plan information by then to also help with that, so. Because to me, that's my key, is the comp plan info, so.
Yeah, I agree.
Okay.
And I mean, I guess I hadn't forgotten that we'd done the strategic plan and the CIP, but those, I was appreciative of the reminder of all the work that we've done that should be included in these recommendations, especially I think we did a lot of work in our strategic planning process
You did.
where that is relevant here.
You have a lot of good information out there. Now kind of the hard part begins about filtering all through and how you're going to prioritize money and staff time.
Dr. Johnson, what is your time frame of having decisions so you can be able to move forward on your end?
That'd be great if you
Sorry.
make the hall up there.
I am just thinking in terms of some of our interested private funders and their timeline, knowing public dollars would take probably 3 months for them to turn around in their organization with their request. So that kind of mid-June date, I think, is the furthest out I would feel comfortable in being able to put in that request to some of our private funders.
And do you anticipate there may be movement before we move regardless?
With some of the funders potentially, but not all.
Yeah.
They're really looking at what's happening from the ARPA investment standpoint.
Do you have any idea when Polk County or the city of Des Moines would be making any decisions regarding, because I think their, at least in my opinion, their willingness to participate is very relevant to our willingness to participate.
Yeah, agreed and no. Do you have a sense of? I know they're in conversation with us, so, but timeline-wise, still waiting to see.
Thank you. Any other questions for Dr. Johnson, for AJ, for John?
Let's see, where's John at? Let's
He
go.
went back to the back row.
What else can we bug the chief about?
You have time before your meeting, so if you'd like to take a brief adjournment to stretch your legs.
Okay, it is 5:43, so we will move to adjourn
I'll second it.
until 6.